prostate is a very unique organ that is only present in a man. It is located just below the bladder and the urine tube runs through the prostate. The prostate gland is actually part of the male reproduction organ. As a man ages, there are two possible changes that can occur in the prostate that can lead to problems in later life. The first change, which is a predictable change, is benign or non-cancerous enlargement of the prostate. This happens to almost every man as they get older. Studies have shown that men, when they reach 60 years old, 50% of men may have some form of prostate enlargement, and this may go up to 80 or 90% by the time a man reaches 80 or 90 years old. As the prostate enlarges, it squeezes onto the urine tube and obstructs urine flow. With the obstruction of urine flow, the patient will then feel that his urination is less forceful. He goes to the toilet more often in the day, as well as goes to the toilet more often in the night. So these are some of the common symptoms that indicate that a man has prostate enlargement. Now, when a patient comes to a doctor with such symptoms, firstly, the doctor will look at the age of the patient. In an elderly patient, we suspect the patient of having prostate enlargement. Next, we look at the severity of the symptoms. Most patients will tell us that they have difficulty passing their urine. They notice that their flow is much slower than their younger days, and they go to the toilet more frequently in the day and in the night. In the night, if they go to the toilet more than 2 times a night, it is considered excessive. And in the day, if they pass more than 10 times in total during the day, it is also considered excessive. Benign or non-cancerous enlargement of the prostate does not happen in a younger man. So it is a process of aging. So that is why our method or treatment is always targeted towards the elderly. We prefer medical therapy, and even if medical therapy do not work, we do not really offer open surgery. We always offer minimally invasive surgery, taking into account that this group of patients are usually older people and probably have a lot of other medical issues. Therefore, these surgical techniques are deemed to be safe for this older age group. There are many forms of treatment for prostate enlargement or benign prostate enlargement. The most common way of treating prostate enlargement is by medical therapy, which is simple consumption of a pill. These pills need to be consumed every day, and these pills work by 2 methods. The first method is that it relaxes the urine tube that passes through the prostate, and this will then directly lead to a widening of the diameter of the urine tube. This will then allow a better urine flow. The second way the drug works is by actually shrinking the size of the prostate. These drugs consumed over a period of 3 to 6 months can result in up to 30% in reduction of a prostate size. More than 80% of my patients respond to medical therapy, and they have minimum side effects from this therapy. In 10% of my patients who do not respond to medical therapy, which means they continue to have significant symptoms of poor urine flow or frequent urination, or when they have exhibited complications of this disease such as urine infection, formation of bladder stones, or even worsening of kidney function, then I will offer them a surgical treatment. The standard surgical treatment that we perform is called a TURP operation, T-U-R-P operation. It simply means we put the patient under a light anesthesia, we put an endoscopy scope through the passage of urine, and we go into the prostate area and we unobstruct the prostate by drilling through the prostate. And with this process, we are able to unobstruct and remove all the offending material within the prostate. This surgery takes about 30 minutes and involves a hospital stay of between 2 to 3 days. This surgery is not painful because it is performed under anesthesia. Following the surgery, the patient will have a urine tube to assist them in passage of urine while they are in hospital for that 1 or 2 days. They may experience mild discomfort due to the presence of a foreign body, which is a rubber tube, in the urine tube. Once the urine tube or the rubber tube has been removed and the patient is sent home, they experience very mild discomfort, but they will continue to see small amount of blood in their urine for up to 10 days. So it is not uncommon, in fact it is expected to see blood stain in the urine for the first 10 days after surgery, but invariably all of them resolve after 10 days. Medical treatment is highly effective. The first drug that relaxes the urine tube and opens up the urine tube to allow better passage works within 3 days. The second group of drugs that actually shrinks down the prostate takes about 3 to 6 months to be effective. Therefore, we usually use a combination of both drugs. The first drug to bring immediate relief, and the second drug to give sustainable results. The risk for the surgery is very low. In the olden days, where the scope technology was not so good and we are not able to visualize well, there was always a risk of injury to the gate or control mechanism of urination, and 20 years ago, many patients do experience urine incontinence or leakage after this surgery. With the modern surgical scopes and endoscopy equipment, we are able to see our way very well during surgery, and the risk of urine leakage after surgery is less than 1% in our patients. Other risks of anesthesia and regional anesthesia for our elderly patient has also been reduced to a very low level due to the better modern anesthetic techniques. Unfortunately, till today, we do not know of any preventive measure to prostate enlargement. So this group of patients could have been prevented from going for surgery if we had picked them out early and given them medical treatment. To us, we treat it as part and parcel of an aging process. What we want to emphasize is the awareness of such a process. We would want patients to come and see us when they have very early symptoms of poor urine flow or frequent urination in the night, so that we can start them on medical treatment early. If they come to see us with a complication such as infection, formation of stones or bleeding, invariably then they are looking towards surgery. The tendency of the prostate to enlarge is a natural process, so we are not able to reverse this process. Consumption of medical treatment such as drugs will only slow down this process. In a more negative way, you would also say that invariably everyone will end up with a prostate that is large enough to cause bad obstruction to require surgery. Unfortunately or fortunately, that is not true, because medical treatment can be effective for up to 20-30 years. So by then, many of our patients may have actually other medical issues that they have to look into, and not only just prostate issues. Alright? So I would very much treat this medical treatment like treatment of diabetes and hypertension, where it is considered a chronic long-term disease that we will just have to manage in a chronic approach.